From anatomy to anesthesiology, from pathology to pharmacology, from microbiology to medicine, a one-man resource to the world of health sciences. Welcome to Dr. Paul's Medical Lectures. A practicing physician, Dr. Paul offers you essential insights on diseases afflicting millions of people around the world. For today's lecture, here is Dr. Paul.
Folks, this is Dr. Paul. Thank you very much for tuning to our channel today. And today I want to talk a few minutes about celiac disease. And I want to introduce you to our website at www.drpaul.org. Please take some time sometimes and visit us. And let me describe the basic features of celiac disease before I talk about labs and treatment. What is celiac disease? Celiac disease is basically a dietary disorder in which there is this gluten, a storage protein resulting in diffuse damage to the proximal small intestinal mucosa with malabsorption of nutrients. And symptoms usually manifest between 6 months and 24 months of age. So that's an important point. The disease maximum manifestation is between 6 months and 24 months of age. Thank you. And mostly this is seen in the whites of Northern European ancestry, and in whom a clinical diagnosis of celiac disease is seen only 10% of patients. You say, what does it tell you? In 90% of patients, celiac disease remains undiagnosed. And especially you see this in patients who come with a lot of non-specific symptoms and signs. So most of the times we can't even suspect it. That's the main reason that we fail to diagnose this condition. But the correct diagnosis comes when only if you keep it at the back of your mind, because every symptom and sign in this condition is non-specific. So you need a very high index of suspicion. There are gastrointestinal symptoms and non-gastrointestinal symptoms that patient can present with. And it also depends on the length of gastrointestinal tract that is involved. Patients usually come with malabsorption, diarrhea, and steatorrhea, and sometimes weight loss, sometimes just abdominal distension, feeling weak and tired and fatigued with muscle wasting and growth retardation. And in older children and adults, and the symptoms and signs are mostly due to malabsorption again. And they can have this diarrhea, dyspepsia, and flatulence because of the bacterial digestion of nutrients is inhibited. And they also can have weight loss. And they frequently say, I am having this abdominal distension, I have no idea what is going on. And sometimes patients come with extra intestinal manifestations like depression and iron deficiency anemia, sometimes bone pains caused by osteoporosis, short stature, delayed puberty, amenorrhea, reduced fertility. So you see all these symptoms. I mean, if somebody comes with bone pain, how could you suspect celiac disease? That's why, folks, so many people go unnoticed, undiagnosed in this condition. Even if you do the physical examination, it depends on the manifestations, how much. For example, if they have vitamin A deficiency, you will see hyperkeratosis, or some bleeding due to vitamin K deficiency, or osteomalacia due to vitamin D deficiency, or neuropathy due to vitamin B12 deficiency, or ataxia. You see, what does it tell you? The physical examination could be anything, and the patients can have a abdominal distension with hyperactive bowel sounds. And the most important thing here is dermatitis herpetiformis. That is the cutaneous form of celiac disease. Basically, they will have a skin rash consisting of pruritic papulovesicles, especially on the extensor surface of extremities and over the trunk, or sometimes even the scalp and neck. So dermatitis herpetiformis is the cutaneous form of celiac disease. That's a very, very, very important point. So you're seeing gastrointestinal manifestations and extra gastrointestinal manifestations. And as I said, the symptoms and signs are most frequently manifested between 6 and 24 months of age. And sometimes they will have the serious form that is called celiac crisis, when they will have hypotension. I will take care of it. When they will have severe anemia or short stage delayed puberty and hypotension, hypokalemia, that's called celiac crisis. So you see, folks, when you do the labs, there are 3 things in the labs. Number 1, routine labs. Anemia, iron deficiency anemia. What is happening? Iron deficiency anemia. Here the blood is not being formed well due to this disease. So in the routine labs, there are serologic antibodies, mucosal biopsy. These are the 3 things you do in the labs. And many times they lose blood in the gut. That's another cause for their anemia. And if a lot of area of the gut is involved, they will have a megaloblastic anemia due to folic acid deficiency or vitamin B12 deficiency. Sometimes impaired vitamin D absorption happens, and they will have osteomalacia, osteoporosis. Now, let me give you one important point. Dual energy X-ray densitometry should be done in all patients with the sprue who has osteoporosis. Okay, so whenever you see celiac disease, do dual energy X-ray densitometry, because these patients have a risk of osteoporosis. And you can also see decreased vitamin A and D levels in these patients because of the impairment of fat-soluble vitamin absorption. You can see low albumin levels sometimes because protein is being lost through the intestines. Sometimes they develop non-anion gap acidosis and hypokalemia because of the diarrhea they are having. So those are the routine labs. Number 2, serological antibodies. In all patients in whom you suspect a diagnosis of celiac disease, you need to do 2 tests. Number 1 is IgA endomysial antibody test. Number 2, IgA TTG antibody test. So remember those 2 tests. Number 1, IgA endomysial antibody. Number 2, IgA TTG antibody test. If they are negative, then you can exclude the diagnosis comfortably. Then what about anti-gliadin antibodies? We hear so much about anti-gliadin antibodies in celiac disease, but they are not useful in the diagnosis because of their lower sensitivity and specificity. And let me tell you one interesting thing. I said IgA and IgA, right? But 3% of patients with celiac disease will have IgA deficiency. So sometimes, even when these 2 serological antibody tests are negative, and if the patient has a very strong suspicion of this problem, then you need to suspect IgA deficiency. Okay, thank you. And if they have IgA deficiency, then you have to do IgA antibody tests. IgG antibody tests. So remember, IgA tests are useful, but if you suspect IgA deficiency, then you need to go for IgG tests. Now the third thing is mucosal biopsy. Endoscopic mucosal biopsy of the distal duodenum or proximal jejunum is the standard method for the confirmation of the diagnosis, and that's the definitive diagnostic test. So when you see a patient with a positive serological test for celiac disease, you need to go for the next step, endoscopy, and you will see that atrophy or scalloping of the duodenal folds. So the duodenal folds like this, they get blunted. And if you look at the intestinal villi, you see the loss of those intestinal villi, and the crypts are gone. And you will see the extensive infiltration of the lamina propria with lymphocytes and plasma cells. So that, remember that a very important point, you will see the loss or blunting of intestinal villi. Whenever you see that point, loss or blunting of intestinal villi, then they're telling you to think about celiac disease. And also the other thing is, if you wean them off gluten, if you give them gluten-free diets, and if you do another endoscopy down the road like 6 months, you will see those villi coming back. That's the beauty of this disease. And so you need a strong suspicion, folks. I mean, if somebody comes with diarrhea, abdominal symptoms, flatulence, don't say this guy has irritable bowel syndrome. No. Wait. Think about celiac disease. Why I'm telling you that is because 90% of cases it's not even diagnosed. Now let me tell you a few things about treatment, then I will finish this. The most important thing is very simple. You need to take off wheat, rye and barley. Those three things. Wheat, rye, barley, eliminate them from the diet. So you're giving a gluten-free diet to these patients. And what about oatmeal? Better to avoid it because many oatmeal you have in the market are already contaminated with gluten. And many of these patients with celiac disease also have lactose intolerance. That's why you need to avoid even dairy products until the intestinal symptoms have improved on the gluten-free diet. So gluten-free diets and dietary supplements. Remember I told you anemia, vitamin deficiency, all of that happens. So you need to give the dietary supplements for the vitamins and the calcium and the minerals in these patients. And what about patients with osteoporosis? To patients with osteoporosis, you can give them calcium, vitamin D. I can also give bisphosphonate therapy. So you need to give them gluten-free diet and wait. Now the most common reason for the treatment failure is incomplete removal of gluten. Either patient is not following the diet, that is the most, or I mean he might be doing intentionally or unintentionally, like some unintentionally when he eats foods contaminated with gluten. As I said, oatmeal for example. So the most common cause basically is intentional or unintentional dietary non-compliance. Non-compliance is the most common reason. And sometimes celiac disease can be truly refractory. I mean, you do everything. The patient says, I am 100% following this gluten-free diet, but still I am not getting better. Then folks, that's a red flag for T-cell lymphoma. Many of these patients develop enteropathy-associated T-cell lymphoma, and you need to remember that point. When the patient says, I am trying everything in the world, I am following 100% gluten-free diet, I don't know what the heck is happening, then you need to think of enteropathy-associated T-cell lymphoma. You need to diagnose, you need to investigate for that. Is there enteropathy-associated T-cell lymphoma? Then, irrespective of removing gluten, you will still have that problem.
Thanks for listening. For more medical videos, please visit us at www.drpaul.org and take time to browse through hundreds of health videos we regularly post on our site. If you are preparing for USMLE, PLAB, and other medical exams, make sure you visit our website to browse through our videos explaining the essential points you need to know before taking these examinations. For more information, visit us at www.drpaul.org. Thank you, and may God richly bless you.